You know our bodies are constantly working to keep us healthy, and one incredible organ, your liver, is tirelessly processing everything that enters your system. But what about substances that are not meant to be there at all? Do you know which ones pose a direct and serious threat to your liver health? When it comes to illicit substances, many can inflict significant damage on your liver, an issue medical professionals often refer to as drug-induced liver injury. Common categories that pose a high risk include stimulants like cocaine and methamphetamine, opioids such as heroin, hallucinogens like ecstasy, and inhalants. Even cannabis, particularly when used heavily or adulterated, can have an impact. The core reason these substances harm your liver lies in its essential role as your body's main detoxification center. When you consume an illicit drug, your liver attempts to break it down and eliminate it from your system. However, many of these substances produce toxic byproducts during this metabolic process. These toxins can directly damage liver cells, causing inflammation, scarring, and even cell death. For example, some drugs can lead to acute hepatitis, a sudden inflammation of the liver, while chronic use can progress to steatosis, which is fatty liver disease, and eventually fibrosis or cirrhosis, which is severe scarring. The liver simply becomes overwhelmed by the sheer chemical burden. Understanding this risk is a critical first step in protecting your liver. The most direct and effective way to prevent drug-induced liver injury from illicit substances is to avoid them entirely. If you or someone you know is struggling with substance use, please know that resources and support are available. Reaching out to a healthcare professional, a support group, or a specialized treatment center can provide the guidance needed to pursue a path to recovery and safeguard your liver's future. It is also important to recognize that the purity and composition of illicit drugs are often unknown. This means they can be cut with other toxic substances that further compound liver damage, making them even more dangerous. This uncontrolled variability makes every dose a potential hazard, contributing to unpredictable and severe liver reactions. The cumulative effect of these unknown compounds, alongside the primary drug, places an enormous and often irreversible strain on the liver. Ultimately, prioritizing your liver's well-being means making conscious choices to steer clear of illicit substances. Your liver works hard for you every single day, performing over 500 vital functions. Giving it the best chance to thrive by avoiding these dangerous chemicals ensures it can continue its crucial work, keeping your entire body healthy and strong for years to come.